this chapter. Role of the government in health. This is from chapter 2, Civics, class 7. Role of the government in health. In a democracy, people expect the government to work for their welfare. This could be through the provision of education, health, employment, housing, or the development of roads, electricity, etc. In this chapter, we shall examine the meanings and problems related to health. What is health? We can think of health in many ways. Health means our ability to remain free of illness and injuries. But health is not only about disease. You may have associated only some of the situations in the above collage with health. This is the collage of the photos. What we often ignore is that each of the above situations is related to health. Apart from disease, we need to think of other factors that affect our health. For example, if people get clean drinking water or a pollution-free environment, they are likely to be healthy. On the other hand, if people do not get adequate food to eat or to live in cramped conditions, they will be prone to illness. All of us would like to be active and good in spirits in whatever we may be doing. It is not healthy to be dull, inactive, anxious, or scared for long stretches of time. We all need to be without mental strain. All of these various aspects of lives are a part of health. Healthcare system in India. Can you provide a little to these columns? Let us examine some of the aspects of healthcare in India. Compare and contrast the situation expressed in the first and the second columns. India has the largest number of medical colleges in the world and is among the largest producers of doctors. Approximately 15,000 new doctors qualify every year. But most doctors settle in urban areas, city areas, okay? People in rural areas have to travel long distances to reach a doctor. The number of doctors with respect to the population is much less in rural areas. Healthcare facilities have grown substantially over the years. Healthcare facilities have grown substantially over the years. In 1950, there were only 2,717 hospitals in India. In 1991, there were 11,174 hospitals. In 2000, the number grew to 18,218. But about 5 lakh people die from tuberculosis everywhere. This number is almost unchanged since independence. Almost 2 million cases of malaria are reported every year, and this number is not decreasing. India gets a large number of medical tourists from many countries. They come for treatment in some of the hospitals in India that compare with the best in the world. But we are not able to provide clean drinking water to all. 21% of all communicable diseases are waterborne. For example, diarrhea, worms, hepatitis, etc. India is the 4th largest producer of medicines in the world and is also a large exporter of medicines. But half of all children in India do not get adequate food to eat and are undernourished. In India, it is often said that we are unable to provide health services for all because the government does not have enough money and facilities. After reading the above left-hand column, do you think this is true? Discuss. In order to prevent and treat illness, we need appropriate healthcare facilities such as health centers, hospitals, laboratories for testing, ambulance services, blood banks, etc. that can provide the required care and services that patients need. In order to run such facilities, we need health workers, nurses, qualified doctors and other health professionals who can advise, diagnose, and treat illness. We also need the medicines and equipment that are necessary for treating patients. These facilities are required to take care of us. For today, this much only, children. You go through this, you will be getting the assignment also attached with this. And next time I'll be explaining the second part of this chapter. Thank you. Stay home, stay safe.